welcome to Imbuto Foundation's first Youth Forum series of the year. For those of us in the room that are first hearing of the Youth Forum series, there are a variety of talks that are held each year involving the youth in interesting conversations that have them speak about issues that are mostly important to them. They also engage them in making decisions that will make them active changers of their world. In other words, the Youth Forum series is one of our cool events because you all get to play a role in what happens after this event. And what better way to start off our series for this year at Transform Africa? So please stay in tune for the second time that we have another one of these series this year. It is a pleasure to see you all here gathered today to discuss the theme, The New Lens, Know, Treat, Suppress. This evening's session will be focusing on the ways that the youth can contribute to innovative ideas in tune with the Digital Transformation Hub in order to fight against HIV and AIDS. My names are Casey Idebe, and I work at Imbuto Foundation. I am actually one of the youngest, actually the youngest member of the team, and it gives me a pleasure to announce that I will be your MC for this session. Allow me to present this evening's program. We are first going to start off with opening remarks that are going to be given by the Director General of Imbuto Foundation, which will then be followed by a video documentary that will be showcasing the journey of some of our innovators in a program we like to call the I-Accelerator, which you will hear about. And we will have remarks from one of our partners, a representative from UNFPA. And after these remarks is everything that everyone here has been anticipating, the great panel discussion. After this panel discussion, we will have a short Q&A, which I encourage every single one of you to participate in, because not only is this a great way for us to learn, but it's also a way for us to be able to contribute to policies and decisions that are going to be made to fight against HIV/AIDS. After this Q&A, we will have remarks from our guest of honor from the Ministry of Health, and then I will have a little surprise for all of us at the end. Now, without further ado, allow me to welcome the Director General of Imbuto Foundation, Sandrine Umutoni, here to give you your opening remarks.
Good afternoon, everyone. Honorable Minister, Honorable Permanent Secretary at the Ministry of Health, distinguished country representative from the One UN family, distinguished partners, esteemed panelists, ladies and gentlemen, once again, good afternoon. I am honored to be with all of you today for a new edition of Imbuto's Youth Forum series, as we are meeting today to discuss the digital innovation that can actually contribute to the betterment of our health systems. We are so excited that it's actually taking place during this Transform Africa Summit, as once again, we're going to be discussing a topic that affects us all as Africans and citizens of the world. Today, as we engage in a conversation on the theme, The New Lens, Know, Treat, and Suppress, our hope is that the young minds that are gathered here are able to help bring forward ideas that will strengthen our efforts in our journey towards eradicating HIV and AIDS by 2030. Distinguished guests, AIDS is the leading cause of death among young people in Africa. According to a report by UNICEF in 2016, it was actually reported that 73% of new HIV infections among adolescents occurred among African youth. The number of new infections is particularly daunting when you're considering that the expected number of young people in Africa will rise to 750 million by 2060. This exponential increase requires us that we invest even more energy in providing the right information on sexual and reproductive health to all our young people, so that we can ensure that they will know how to prevent new infections within the demographic groups. The efforts being made are tremendous, but they will also require the youth to be a driving force in combating one of the biggest threats to their lives. Dear youth, we cannot give up, nor can we become complacent in the face of an ever-evolving disease. Indeed, the fight against HIV and AIDS requires that all of us really stay on top of prevention and treatment efforts. So we are here to tell you that you must be involved in the creation of solutions that greatly affect you, while including the digital component to ensure that these solutions appeal to our current times. So allow me to briefly share with you some of the interventions we've had here at the Imbuto Foundation in line with the promotion of a healthy population. In 2017, Imbuto Foundation, in collaboration with UNFPA and UKAID, launched the Innovation Accelerator, or iAccelerator, which is a program that is done in different countries of Africa. So this program was launched in Rwanda last year in an effort to urge young people to find solution to the stigma that is still built around sexual and reproductive health. Through the nationwide campaign, hundreds of youth participated and shared business-oriented solutions or ideas that presented different opportunities to aid in the fight against HIV and AIDS. Through initiatives such as the iAccelerator, we are reminded that once involved and given the right platforms, the youth will contribute solutions that further engage, empower, and educate all our communities. So indeed, our communities can thrive and live the dignified lives that we are all entitled to have. So distinguished guests, without further ado, I just want to again emphasize that as health advocates, we need to further encourage our youth, nurture their ingenuity and capacity to develop new solutions that fit and respond to issues that are in line with world's digital age. Indeed, our young people have showed that inspiring spirit of innovation is the key in this fight against HIV and AIDS. So as I conclude my remarks, my hopes for everyone are that groundbreaking ideas are conceived in the light of a digital transformation. Let us not only look at this fight through a new lens, but let us become the new lens through which our current issues are transformed into solutions. I thank you very much for your kind attention and wish us all a fruitful discussion. Thank you.
A big thank you to the Director General of Imbuto Foundation for giving us such insightful remarks. As she mentioned, the Innovation Accelerator program saw such a great success last year, showing us our 4 innovators that emerged as winners of this competition. The documentary that you're about to watch not only shows you how far they have come since the program, but they also share with you their experiences. We hope you enjoy it.
The iAccelerator was developed in partnership between Imbuto Foundation, UNFPA, and UKAID. And the aim of this accelerator program was to encourage young people between the ages of 18 and 30 years old to come up with business solutions that are sustainable and providing at the same time information to young people about sexual and reproductive health. So this program was started in December 2016 and it was implemented throughout the year of 2017. We received great response from the youth across the country with hundreds of applications coming to us. We selected 40 top, and the next phase was basically the process through which we selected 10 best who were going to the next stage, which was the pitching contest. Out of the 10 best pre-finalist ideas, we selected top 4 winners who were basically young people who came up with great ideas in terms of innovations using web-based application, comic stories, but also a TV show to address the issue of sexual reproductive health. Those top 4 finalists were also selected and benefited from entrepreneurship, support, mentorship, ideas to further develop the innovation, and also received seed funding of $10,000 US.
Since winning the Access to Competition, Girl District has been able to mentor 40 girls. We've also been able to have 3 co-hosted community dialogues where we talk about different issues with on sexual reproductive health, as well as gender norms and feminism. Also, we already have our first episode of the comic book, so we already have the e-version ready to be printed by the end of this year.
Since winning the iAccelerator competition, we mainly worked in 3 sectors. So the first was about the website. As we previously had the website, so we updated it and improved it. So it was marked by moving from less than 5,000 users per week to more than 10,000 users per week. The second one was about Tantin app. So we developed and availed it at Google Play Store. So since last August, we now have 1,500 users. So the third one was about reaching out to people and teaching them face-to-face. So we reached out to Maham refugee camp. So we meet 6,000 of young people living there, and we teach them about sexual and reproductive health education, and we mentor them.
Ababyeyi bo mu Rwanda ngo ntibaganiriza abana babo ku buzima bw'imyororokere ngo ni uguta umuco da. Iyi filime rero nibyo igiye kuvugaho.
I and my team have worked on a project called Tubiganire TV series. It is a TV series that mainly stimulates Rwandan parents to open up to their children and have sexual reproductive health related conversation in family settings.
Kakantu nyine nagakuye mu cyumba cyawe. Si keza karambereye do.
Ariko wa mukobwa we nta kintu mba gukinga ibintu byose mba mbikubwira. Ikindi kandi urunigi rukoreshwa n'abantu bafite iminsi yabo idahindura 28.
Tubiganire TV series was just an idea before winning the iAccelerator. From that time on, we have managed to produce 4 10 minutes long episodes. Also, we have worked on another project that's related to Tubiganire TV series, which is a mobile application through which our audience will get to view and watch our episodes freely.
Umbrella is a social enterprise with the aim to educate and empower women to make informed decisions in their sexual reproductive health. Since winning the iAccelerator competition, we were able to develop the application that we called Umbrella, and now we are working on the pilot phase for the application. We are working with 11 girls that are helping us test the application, and we are using their feedback to improve and refine the application.
Ntabwo nari nzi kubara ukwezi k'umugore, nta nubwo nari nzi uburyo babikora kuko nari umuntu uriregiriye cyangwa se umuntu ufite amatariki ahora ahindagurika. Bampaye application banyigisha n'uburyo ikoreshwa. Mu kwezi kwa mbere bayimpa uko bari banyigishije kubikora, amatariki yanjye yarahuye neza, ndetse n'umunsi application yari yambwiye kujya mu mihango nayigiyemo numva birantangaje.
As Umbrella app, we are here to assist you with the relevant information about sexual reproductive health with only one click on your phone.
Our big milestone this year is to have more partnerships, be able to have more girls benefit from our program, and also be able to have this comic book available to more students.
Within this year, we want to produce 2 seasons. One season is made up of 12 episodes, and right now we are at the 4th episode. And we also are working on our distribution platform. We want to start distributing our own content through our own platform.
My message to the youth is not far from the saying that there must be nothing for us without us.
We encourage the youth, especially young women, to take ownership of their sexual reproductive health.
We acknowledge that there is an interest on the part of young people to access this information related to sexual reproductive health. At the same time, we're able to address the issue of entrepreneurship. These young people should not stop, they should continue, as we believe they have a very strong gift within their hands that has great impact over the next future generations.
We hope that you enjoyed this short video and that through it you were able to learn more about not only Innovation iAccelerator, but also meet the faces behind the 4 brilliant ideas that were developed here. Now, as you heard in the video, some of our collaborators were UNFPA. And it is my pleasure to call on the UNFPA representative to come here and give us their remarks. Thank you.
Thank you, MC. Honorable Minister of Health, Permanent Secretary, Ministry of Health, DG Mbutu Foundation, DG RBC, distinguished leaders, development partners from government, private sector, NGO community, the One UN family, and most importantly, the youth leaders that are here today. Good afternoon. On behalf of the One UN Rwanda family, and it's a pleasure for UNFPA to join this exciting youth forum, one of the cool events, I'm told. And Transform Africa is about connecting, it's about innovating, about transforming. And as we just watched in this inspiring video, the youth series is about the importance of investing in young people, investing in their creativity, in their talent, in their innovation, to lead the transformational change that we strive to see across the continent. And never before have there been so many young people. With more than 60% of Africa's population below the age of 24, accelerating Africa's single digital market will not be possible if we do not prioritize investment in human capital development. Our AU Agenda 2063 provides the vision. Africa's young people are the primary vehicle for realizing the demographic dividend and the principal engine for fostering development at all levels. However, achieving the demographic dividend doesn't happen automatically. There's a need to recognize that sustainable societies rely on empowered individuals who are able to exercise their rights, including their rights to access quality health and education. One of those critical areas in building human capital is ensuring young people's access to sexual and reproductive health. Young people often face barriers to sexual and reproductive health, making them extremely vulnerable to diseases such as HIV and AIDS, to unintended teenage pregnancies, which can impede their ability to access education, employment, and effectively contribute to the development of their society, of their country. Africa has among the highest rates of adolescent fertility and the highest child dependency rates in the world. Here in Rwanda, the demand for modern contraceptives continues to lag for some unmarried women and adolescents, and teenage pregnancy rates have risen to 7.3%, with youth-friendly services still limited in scope and coverage. Investment in the health of young people, including recognizing the importance of linking sexual and reproductive health and HIV interventions, is key. Positive prevention strategies, with shared responsibility of preventing HIV by both HIV positive and HIV negative people, are a successful example of how we can ensure that vulnerable populations have a voice in protecting their own health. This week, we're celebrating advancements in ICT across Africa. So how can we use these incredible technological advancements to solve challenges in bringing health and in bringing education to everybody in society? How can we use these as building blocks? How do we solve challenges related to young people's sexual and reproductive health, while at the same time supporting their innovation and entrepreneurship? One effort has been iAccelerator, and UNFPA has been proud to partner with the Mbutu Foundation, with the support of the UK government and DFID, to have led Innovation Accelerator, an initiative to explore new creative ways for young people to solve pressing population issues, and at the same time promoting their social entrepreneurship. As you've seen from the video, iAccelerator is a mentorship-driven program supporting young entrepreneurs with seed money, training, and skills development to generate innovative solutions in response to the challenges that they are facing around sexual and reproductive health. So far, 2,700 young people have been supported through boot camps across 4 countries in East and Southern Africa. 19 startups have been awarded, and on today's panel, you'll get the chance to listen to one of the talented Rwandan finalists, Umbrella. In closing, I'm really pleased to see that on the panel that we're going to have today, it brings together unique stakeholders from across different sectors that are going to be key to developing Rwanda's social and economic development. Fostering synergies between government, private sector, NGOs, and youth-led organizations remains key to unlocking solutions that are developed for young people and by young people. Using technological platforms and innovations, as those we're about to hear today, can serve as building blocks to provide new tools to share valuable life-saving information and reach the most vulnerable that can be left behind. The returns on our investments in young people are enormous. With all the creative solutions we've already seen, we know there are many more on the horizon, and we don't have to look far. Let us work together to support our young people to drive the social and economic transformative change that we want, by encouraging them, by empowering them, and by using platforms like Transform Africa to unite them. Thank you, Mbutu Foundation, for organizing and making this conversation possible, and we look forward to a valuable discussion. Thank you.
Thank you to the UNFPA representative. Now the moment that we have all been waiting for has finally arrived. Are we excited? Are we excited? Perfect. Now, without further ado, let me call on Jeanne Umuhire, who will be the moderator for this panel, who will not only introduce us to our distinguished panelists, but will also start us off.
Hello, everyone. Thank you for the introduction, Casey. So my name is Jeanne Umuhire, and I'm incredibly stressed, but also happy to be here. In previous years, I was on the other side. I've seen Youth Forum series from the very start to now, and when I was called to be on the other side, I was like, ooh, why me? But I think that I'm actually really excited because even as I work for Team Heart, which is an NGO that with a mission to lead sustainable cardiac care in the country and beyond. So on the other side of the health spectrum, so we know of the infectious diseases such as HIV, and this is the focus of today, but being on the other side on a day-to-day basis, on the communicable diseases side, I'm jealous. I'm jealous about people working in HIV because you have all the funding at the moment. But I also, so this is why I guess my panelists are a little scared because they think I'm going to challenge them. But I also really join in the cause. I mean, we all know that HIV is still taking a toll on African lives, and we should not, and we will never, diminish our efforts to sort of contribute to the fight against HIV. So without me going more in, about myself, I would like to introduce you our esteemed panelists because they're all actually experts in their field, different fields, but really great at what they do. And I'll start with Dr. Sabin. And if you are in the HIV field, you probably know the name Dr. Sabin Nsanzimana because he's the director of the National HIV program in Rwanda. He has been leading the HIV unit, It's not actually a unit, it's a division in RBC, the Rwanda Biomedical Center. And he's trained as a medical doctor, but he recently actually obtained his PhD in clinical epidemiology from the University of Basel in Switzerland. So I guess we should, applaud him because that is remarkable. He has over 12 years of experience in HIV/AIDS, TB, and viral hepatitis design, implementation, and clinical research trial. And another impressive fact about Dr. Sabin is that he has published over 100 research articles in peer-reviewed journals and book chapters. So Dr. Sabin, please join us. And he is also the only male representative on the panel today. Next on our panel is Mrs. Tona Isiwo. She works for Global Communities as the Deputy Chief of Party of the USAID Twiyubake program. She's a program management and M&E professional with over 9 years of experience working in the development sector with international NGOs and government institutions. Particularly in the past 6 years, has worked with PEPFAR USAID programs focused on supporting orphans and vulnerable children, HIV/AIDS prevention, and economic strengthening interventions for vulnerable families and youth. In her current role, she's supporting the implementation of the PEPFAR-funded DREAMS intervention in Rwanda. DREAMS aims to reduce rates of HIV infection among adolescent girls and young women across 15 countries in sub-Saharan Africa. Tona, please welcome to the panel. She'll be the representative of what in the health field we would like to call partners. Joining us on the panel next is Malise. Excuse me as I So Malise is the manager of social health and healthcare at Kasha. Kasha is a private entity. She has experience working for various nonprofit organizations that focus on gender empowerment and women's health. She received her bachelor's degree in international relations and women and gender studies and an MPH from Boston University. In her current role at Kasha Rwanda, which is an e-commerce platform designed to improve women and young people's access to health products in a confidential and convenient way, Malise is leading efforts to make the platform accessible to women in low-income communities and oversees the healthcare department. Welcome, Malise. And last but certainly not least, we have Fiel Nabergue. She was actually portrayed on the video, the short video that we just saw. She's one of the winners of the iAccelerator program, and she co-founded Umbrella. Fiel is a second-year student at African Leadership University, pursuing a bachelor's degree in international business and trade, and she also works as a front-end developer at DMM Hehe. And as if that was not enough, she's also the co-founder of Umbrella Technologies, which is a social enterprise with the aim of empowering and educating women about their sexual reproductive health. At Umbrella, Fiel is in charge of overseeing the execution of the project and making sure that operations run smoothly. She's going to sort of be the advocate for the technology industry field, as she has over 4 years of experience working in technology industry. Welcome, Fiel. I guess we may get started with the conversation. And I'll start with Dr. Saban. Some of you might have guessed, as the representative of the government on the panel today, Dr. Saban. Don't worry. I'll ask an easy one. And you're definitely going to be, you know best about the program, so I know you have all the answers. So just to put us all on the same page about HIV, we all know about HIV. It's a really bad disease. It's affected many. For the last 20 years, we've heard all about HIV, but we've also heard that HIV's eradication, or at least the fight against HIV in Rwanda, has been a great success in the last 20 years. And most of you in the healthcare field, or even, in other fields, you've heard that Rwanda is actually an example among many countries in Africa on fighting the illness. So, Dr. Saban, as the director of the national program, would you please let us know what that journey has been like? How far have we come, and where are we today, especially in terms of the youth and adolescents in terms of HIV?
Thank you, Jean. Good evening. So the journey has been long, but also cool. Seeing the results, achievements happening over time has been another booster to move forward. Maybe you can start with some statistics to just put the history in the context. Like any other country in sub-Saharan Africa, HIV has been a concern, and no one knows exactly when it started. But in 1981, in USA, the first case was described, and 2 years later in Kigali at Seashika, the same case of AIDS was also described. So no one knew exactly where the first case happened. And Rwanda has a unique history. The fact that in 1994, with the genocide against the Tutsis, HIV has been benefiting from the chaos and all the tragic history we had. And that puts us in a situation that we had to start far behind other countries to rebuild the health system, but also the HIV program in that context. And the youth has been affected than other groups, as you can imagine. My first year when I started in treatment research for AIDS Center, more than a decade ago, I had 800 youth, young people who are just starting treatment, and I was asked to follow them. And myself, I was still in the youth category, but no more, unfortunately. So having been with the young people over the last decade, it gave us some lessons, but also some challenges we've seen, as has been mentioned by the previous speakers. This is the only category of people where more new infections are happening, more death, and resistance to treatment. And it's not only in Rwanda, it's also in other countries in the world. And it's a concern. And I hope sometime we will reverse the situation. But there's some good news, especially in the area of PMTCT, prevention of HIV transmission from mother to child. We've seen a significant decline of the infections from mother to children, from 10% to 1% today. And these are the next leaders of this country that will grow without HIV. So some lessons, some challenges, but also some good news. And seeing these innovations and digital platforms, the new tools we have, we are making some good progress. And having this partnership and global solidarity on board is another booster to move forward. So when I meet those young people I started with in track 10 years ago, now they have become parents. They have become leaders. They're taking some actions. It's also another motivation that I would mention as, although they had HIV, but doesn't stop them to live. It doesn't stop them to contribute to the growth of the country. They are contributing, participating in different ways. So those are good news from the tragic history, from the past, from all the ways we went through. I think personally I'm motivated to continue, and sometime soon we'll have this AIDS ended and probably tackle other epidemics like we've started now with cancer, with heart diseases and cardiovascular diseases.
Thank you, Dr. Saban. I'll move on to Tona. From what Dr. Saban has told us, it almost sounds as though, AIDS has been taken care of. The challenges are there, but they're not that many. Would you be in agreement? I know that your programs are specifically targeted to young women and girls, but what do you do differently? Is it just enough to talk about AIDS? What is the innovation part that you bring to the field?
Thank you. So Jean said I'm representing the partners, but I think that's a huge responsibility because there's so many partners in the field of HIV mitigation, and I would say I'm just representing a very small portion of the partners who are working at the community level, implementing OVC programs. OVC stands for Orphans and Vulnerable Children. And OVC programs basically support vulnerable populations, including adolescents and young people, to mitigate the impact of HIV/AIDS. We know that as part of the continuum of response, we need to go beyond just clinical interventions, and this is the sphere in which OVC programs are implemented. So responding more to the economic, social, psychosocial, educational needs of orphans and vulnerable children and their families, and basically strengthening their capacities so that they're able to mitigate the effect of HIV/AIDS. So in terms of what we are doing as a program and basically what's happening in the OVC field, so we are not only targeting vulnerable, we're not only targeting young girls and women, but we're also targeting broader adolescents. But there are two different programs. So in OVC, we're looking to strengthen families and strengthen their response to the HIV/AIDS epidemic. Some of the ways we're doing this is through education support. So we know that education is undisputed as one of the biggest ways to fight the HIV/AIDS epidemic. We know that by completing primary and secondary school, individuals are much more likely to be able to prevent HIV/AIDS. And we know that some of the ways that we know that in Rwanda we have we have 12-year basic education. So what OVC programs are doing is providing other education support, so providing materials for vulnerable children to make sure they're able to stay in school, but also monitoring attendance to make sure that they're staying in school. Also, economic strengthening is a very important aspect of addressing the HIV/AIDS epidemic. And this is because HIV has a huge impact on the economic stability of families. So by strengthening their capacities through whether it's household grants or financial education, teaching them how to save, etc., you are avoiding the vicious cycle that's created by HIV/AIDS and ensuring that their children will be able to have a better future. On the side of adolescent girls and young women, as you mentioned, there's a program called DREAMS. I was discussing earlier with Dr. Sabe because he was part of the design in Rwanda for the DREAMS program, and now we are on the implementation side, and he was asking me if the dreams are coming true. So DREAMS is actually an acronym for Developed, Resilient, Empowered, AIDS-Free, Mentored, and Safe. And DREAMS aims to help aims to address the high incidence of HIV in this population of adolescent girls and young women. So some of the work that's being done revolves around keeping them in school, but also largely providing them with SRHR education, HIV prevention, and linkage to testing, treatment, and care as required, but also supporting their families through economic strengthening and through parent and caregiver programs to increase their parents' capacities to talk to them about sexual development, about sexual reproductive health and rights, because we know that parents and caregivers can play a critical role in supporting girls to prevent HIV/AIDS.
Great, thank you so much, Tona. So from Dr. Saba, we've heard that the country is putting all the measures in place to sort of fight HIV/AIDS. The challenge is still in the population of youth. As we've heard, it is the only group that is still experiencing a rising incidence as opposed to the other groups. Is that the case indeed, Dr. Saba?
In terms of absolute numbers, yes, it's true. But in terms of trend, new infections are declining in general in Rwanda. So the absolute numbers I was talking about is from a recent study we did at the Rwanda Medical Center. So we followed over 14,000 people for a year who were HIV negative. Then after 12 months, we retested them again. And out of those 35 who got infected, majority were young people and singles. So, but in general, when you put in proportions, they are not the one that having pneumonia infections, but it's a concern. And indeed, as we speak now, every 1 hour, 2 hours, there's one infection is happening. After this session, we already have someone infected, newly infected. So that's why it's a concern. So yeah, I concur with what we said. This is a group of people that need to have special attention, and we have already started with special programs.
Great, thank you. So I just wanted to be sure that I painted the picture right. So we have infectious diseases, we have HIV, greatest toll of lives lost, greatest burden of disease in Africa. However, we've been doing great in Rwanda in making sure that we sort of fight against HIV. Numbers have been going down, but the youth is still facing, the largest problem. From organizations such as TONAS, their programs meant to build sustainable care for people that are affected already, and to sort of prevent that, especially in vulnerable populations. So that sort of makes it a very overall, very big picture, sort of problem. But what of, the youth that are just like you and I in the audience, what can we do on a day-to-day basis to participate in the fight against HIV? We can't leave everything to the government. We've been encouraged to do things on our own, to find our own solutions. And I'm fortunate enough to have Fiel in the audience, in the panelists, to explain to us what that has been like. She was part of the few innovators that thought of doing something. And I would like to know what that was like, and especially since you won the iAccelerator initiative, and how far you've come since then.
So we started the program, I think it was starting January 2017. So the concept was finding innovative solutions for young people about sexual reproductive health. And we thought that was as simple as it could get. So we applied and we wrote all the essays, we sent out our application, and after the first selection, we went for an interview, and UNFPA really destroyed us, really. So they really challenged all the concepts that we had, because we were bringing all the technology, but we weren't really thinking about the end user, that young woman who would be using the app, or who how they would interact with them, the efficiency exactly. So what I think we learned the best from the whole process, for me, it was the most insightful around sexual reproductive health that I would have gotten really ever. So we got to learn about sexual reproductive health in general, but also we dived a bit deeper. We are not the experts yet, but we really got to understand the subject. We also got training from Inhomoko and K-Lab, so we got to also work on the business side of things, which is also still in progress. But I think our biggest take was that we needed to do better, and we continue building up on that, and we definitely got to know. It was eye-opening for us because we actually learned about sexual reproductive health. It was not this subject that we see on TV and never really care about. It was something that we got to understand and got to care about, and started really thinking about and finding ways to solve it in a way that is great for our target audience, really.
Thank you, Fiel. So we saw in the video that we saw a little bit of what the app might be about. So if I understand well, you get information on how your menstrual cycle is and about reproductive health in general. But to me, it sounds like this is an app for women. Is that the case, or can men also look at it?
This is just like in a business model canvas, really. I'm just citing what we did. So we are mainly targeting women, young women between the ages of 16 to 30, really. And so the men, they can maybe read the articles. That's extra information for you guys. But you only to track your cycles, but the app really is to empower women and girls to learn about sexual reproductive health and make informed decisions in their lives. So really so that they can fulfill their potentials. So the men, please read the articles.
Sophia, thank you. I mean, I won't bug you any further on that, but it's actually food for thought for everyone here. Is reproductive health a women's issue? Should a husband know when their partner or just a partner know when their partner has, is ovulating or not? I think this is really food for thought for the way forward and how we should be tackling family planning in general. But I'll let it be I won't bother you anymore on that field. Now moving on to Malise. I know Malise is excited because she has a lot to say. She has interesting things to say. And I'm actually interested in what she had to say. Malise works for Kasha, but she can tell us more on how that works and the products that they have and how they think they're going to revolutionize the field, actually.
Thank you, Jeanne. No pressure. So I'm with Kasha Rwanda, and as Jeanne mentioned, it's a new approach that we have here as a private company to address some of the challenges that youth and also young women. Oh, sorry. Can everyone hear me better now? Okay. So we are I'm with Kasha Rwanda, and we are a private company that is trying to improve access to. Oh, thank you. This is going to be better. So Kasha Rwanda is an e-commerce platform that was designed for women as well as young people, where among other products, it is possible to purchase contraceptives in a confidential and have them delivered to the customer's location of choice. So we say that we are offline and online because a person can access our platform by either visiting our website or downloading our Android application and placing the order online. However, we know that not everyone has access to internet. Therefore, even if you just have a simple phone, there is a short code that you can dial, and you're able to place your order confidentially. So in terms of the range of products that we have, specifically in relation to contraceptives, we have daily pills that women take every day. We have emergency contraceptives. We also have condoms, and also long-acting methods, which are injections or implants. And for all of us healthcare experts or professionals here, for the injections and implants, we don't send them to the customer, but we connect them with health partners that will do the injection or the implant in a confidential and convenient way. More in relation to the discussion that we are having today, we have started collaborating with Project San Francisco since February 2018 in the distribution of HIV self-test kits using our platform. And the way we do it is they are distributed for free and added to orders of condoms or emergency contraceptives or pregnancy tests. And when I say add, it is not mandatory. So it means if you are our customer and you request those products, we don't send the test and it comes as a surprise. We do ask you ahead of time if you're interested in having this product added to your order. And there's a reason we offer it to someone who is ordering, for example, an emergency contraceptive. We know that you are sexually active, and so this product is more relevant to you, and you belong to a group. If you're sexually active, it is recommended that you check in with your status, whether it's HIV or other sexually transmitted infections. So in getting feedback from our customers, what they enjoy or appreciate in using our platform is that it's confidential. When you're ordering here, you could be placing the order right now to Kasha and no one is aware. You don't have to walk in, let's say if you needed to go into a pharmacy and place the order. And that speaks to our mission as well, because what we want to do when we think about contraceptives or even the HIV self-oral test kit, it can be very intimidating for a lot of people to walk into a pharmacy or even a health clinic if it's offered for free. I'm even willing to bet that some of us cannot do it in this room. So having other channels of distributing these products, thinking about if we're talking about young people, is the most comfortable experience walking into the pharmacy, is the most comfortable experience going to a health clinic where there might be people that know me.
And so that's what we have really been trying to do, where we leverage technology to bypass, when possible, the tradition of face-to-face interaction that is required in getting products that are often stigmatized and not easy to access in person. So we have been able to distribute over 400 HIV self-test kits. We're continuing to do that. And we've delivered over 12,000 orders in Kigali. We have just expanded to Huye as well. We just opened an office there. And we're also, since February 2018, in Kenya. So work in progress, but we can bypass traditional.
Thank you, Marlies. I have more questions, but I think that, for everyone's sake, it would be best to sort of already have a few questions come from the audience to see if you I already see one, okay. I think that I'm biased. I'm going to actually let the DG of RBC ask the first question.
Thank you so much, Jeanne. Thank you, panelists. I'm learning a lot. Actually, we should do this a lot. You know, Marlies, you said something that is actually trying to work on because adolescent, as Dr. Sabin said, is our key as well. As he said, HIV is not only the most disease that is affecting this group, but also we are seeing malaria, simple like malaria and others. I think it's interesting to see the profiling of your clients. Without names, confidentiality, it would be good to know that so that we see who is the type of the customer you have. Can you extend it to the rural population? Can you extend it to students? Can you extend, So it's good to know that in general so that I think policies can be based on the facts that you have. So I think this is really exciting. And it's something that we can learn from you and move forward and in changing the policies that we put in place that is tackling and targeting the adolescents. Thank you so much.
Welcome. So somebody has been raising their hand at the back there. But a little caveat, only one question or comment per speaker, just so we don't have anyone that's jealous.
Thank you so much. Magnifique Irakoza, my name's, and I'm going to direct my question to the representative of RBC. I'm a doctor by profession, so I know actually about HIV and I know all the steps the government is doing. They are quite amazing. But I have a question. We have not been able to shake the 3% prevalence of HIV in Rwanda for almost a decade. So I'm asking myself, how are we going to move that, It's been there. It's a wall that I feel like we should hit it and go beyond. So please shed some light on that. How can we move forward and make sure we are no longer the 3% prevalence, probably 2, 1, or even 0? Thank you.
So thank you for the question. I would also want to encourage, if in the audience there's anyone living with HIV, to share the testimony, because we also, we need to hear the patient group, the advocacy side, to know what to do better as policymakers or partners. Or anyone who has interacted with a person living with HIV.
Thank you. My name is Viator Muragijerema, and I work for Kigali Hope. Kigali Hope is a local NGO working with young people living with HIV. I have a question for Mr. Sabe, Dr. Sabe, I'm sorry. We recognize that there is a quite big number of young people living with HIV in Rwanda. And there's also a big number who are still at boarding school, in secondary school. At boarding school, there is a problem of taking ART, the antiretroviral treatment, because of stigma and discrimination at school. They fear their friends at school, and they they don't take ARV at school when they're at school. What do you plan to address that issue? Thank you so much.
Thank you very much. I think it would be best to sort of answer those questions now and then go, if we have more time, go for the next round of questions. I believe that Dr. Sabin, you've been asked questions, and Malise, maybe a comment to respond to Dr. Kondo.
Sure. So in terms of the profiles of our customer, we serve students, and of course, again, everything is done confidentially, but based on the location, we can know who we are serving. So we work with high school as well as university students. They're part of our customer reach. We also serve professional women living primarily in the urban areas. And we also serve women living in low-income communities through an agent network, because we also understand that if you're trying to reach what in business is called bottom of the pyramid customers, not even everyone has access to a phone. So the women that we train to be our agent go into the low-income communities and are able to talk about Kasha and the platform, and also help women in their community use it. So really we serve a range of customers for high to middle to low-income women. So far we are primarily in Kigali, but as I've said, we've also started operating in Huye, and the idea is to be able to continue to have the platform available in other areas. But it's a mix of young people and I guess adults or older people, and it might be that younger people are around 40% of our customer reach. Thank you.
I think maybe a quick comment on Malise's presentation. We are very interested to explore that, and you have been planning that in RBC with our e-learning platform, where not only people can order products online, but also can learn how to use those products online. So this is an interesting idea. I think tomorrow we can meet and explore more. So on the question of 3%, maybe I'll explain how we measure this 3%. And I don't expect this number to reduce now or next year because of what I'm going to explain. So this is a prevalence number that we measure out of a sample population, including HIV positive, including HIV negative people. Then we sample households. Then we measure those who have HIV. Majority of those who are considered 3% are already HIV infected and are part of our program. So we don't want to lose them. They need to live longer on treatment. That's why this number remained flat, because those who have been infected are still in the program, and they will stay in the program. And indeed, we measure the life expectancy of people living with HIV in Rwanda, and is similar to those who are not infected if they start treatment before the immunity goes below 500 CD4, which is a level of immunity defense of the body. So, however, as the epidemic is aging, is shifting to the right, we see the peak of infections moving towards the people who are 50 years old, 60 years old, and probably in the next 5 years or 10 years, we'll see the prevalence going down maybe to 1%, because the younger people are, as I said before, those who are below 15 years, the prevalence is really low, below 1%. So those ones will get older at the age of 50, as the other ones have already moved to 90 or 100. So in that time, our measurement of prevalence will not capture those ones, and the prevalence will reduce. But as of now, if the prevalence reduces, it's a problem. The death will have increased. Second question on ART in schools. I think we know the issue since like 5 years ago, and some actions have been made with the new model of giving patients drugs for longer period. Because even before, schools were not allowing children or students to go out and pick medicine. So we decided to give them like 3 months stock. They can keep their stock for 3 months, but also educating the school heads on to create an environment that helps the students to take their medications in full confidentiality mode. So we know it's still an issue, but as the simplification of treatment also happens, we hope it will be solved. As we speak about innovations and digital and research bringing new ideas, I think you've heard that this new research of injectable drugs that are being studied have been presented recently, and soon in International AIDS Society in Amsterdam in July will be again presented results. Interesting, where someone gets injection for 3 months or 6 months instead of taking pills, then you can remain on treatment just because of that injection. Another research being conducted on long-acting antiretrovirals. It's still in the research development. It's a pill you swallow, then it remains in the stomach, then it can release doses on a daily or weekly basis for 6 months or 1 year. So those are new developments that we are following closely. Probably we will be solving this issue long term. But otherwise, we'll continue to work with schools to facilitate those students who have issues of confidentiality with their medicine. Yeah. Thank you.
Thank you very much, Dr. Seba. So it sounds as though in terms of suppressing and treating and managing HIV/AIDS, we have solutions. But what of knowing our status? Malise mentioned that there's the issue of confidentiality. Sort of, not everyone is comfortable just walking in a pharmacy and buying an after pill, emergency pill, Plan B. But they've provided the solution. As I open the floor and have the audience ask more questions, I want us to be thinking of, perhaps I could go on the app and purchase whatever I need, but what of the person in a very remote area that, one, does not have a smartphone, two, maybe does not even know how to read? What is left for them? I just want us to think about that, but I'll let DG. Yeah.
Thank you, Jeanne. My question goes to Malise.
Yes.
In my time, it was important before doing a test, HIV test, to have a counseling, because you can have some issues depending of your results. So at Kasha, how is it done, the counseling? Yes. Is it still on, or for young people it's not important? Thank you.
We'll ask another few questions. I'll leave Tony the liberty of choosing.
Our job.
Okay, I have a quick question based on your comment, because I think it's very important. I think the information got lost. The fact that one of the things that struck me in the program was that Tubigani, a TV show that brings in a setting of parents who are talking to their kids about sexual reproductive health, which is not the reality in Rwandan families, right? And that's why we have a growing prevalence of adolescent girls who are becoming HIV positive. And so I think we have to discuss for every program that's related to families, how do you change mindset so that parents are having these conversations with young people, which helps the interventions that come later, not to put Kasha out of business, but if you are catching it early, you're able to put Kasha out of business, because you don't need anonymized programs even if they continue. I mean, the fact that our young people have to rely on an anonymous platform is really a problem. And so what are we doing as a community, as a country, to not just treat, to not just have programs that capture the vulnerable people, but also have parents or those of us who are parents now, how do we go forward? Maybe not our parents, because that's never going to happen, but maybe young parents, how do we get them to talk to their children? Because that is a factor that's missing in this conversation.
Thank you so much. That is indeed something that was lost in the conversation. And I'm not sure if there's a representative of the family ministry, but I know that the Minister of Youth is in the audience. Yes, yeah. So I would like for you to please maybe address this concern, but also touching on, I know I'm giving you a lot of responsibility, but also touching on schools. We do not have the conversation in families. We do not have it, as far as I recall, I did not have it at my school in Rwanda. What are policymakers thinking?
Thank you very much. I really want to appreciate what the young people are doing. Like my colleagues mentioned, I'm also learning a lot from you, and I didn't know this much is happening in the field. I was caught off guard, but I'm ready for the intervention that you asked because I'm representing the colleagues not here. The question that you raised is very pertinent, and that's why even the scourge is increasing, like they said, especially among the young people. Because as a culture, normally it's like a taboo. That's the past. They used not talk about the sexual reproductive health in public. It would be something that would be discussed in secret discussions where girls speak to their aunties and that kind of the past. But the dynamics are changing completely, and that's why the discussion now has to come open and discuss this. Because the social media, the media out there will provide the information that the parent is not doing. So parents are taking the responsibility of their children at schools at the same time. And this is what we are encouraging mostly, that parents, we should take responsibility of our children, and we discuss about all this. First of all, you have to be a friend of your child so that they are free discussion, these free discussions. And there is no, I think I saw it in the movie, or the Tuganire, the one which, to be Ganir, yeah, that, I think we need this coming especially from the young people that would air out on TV and the radios so that it can open up. We have various partners in this program, the Nyambinga radio in the rural areas where they discuss about this, and girls speak to girls. But also, we don't want to find this as a girl issue or women issue. It's general. It's for men, it's for boys, it's for girls, it's for women. So it's for all of us, because it's like you're telling your girl to take care, but the boys, you are free. You move on and do all this without any control. So it's also sexual education, sex education should be for both girls and boys. If it's about contraceptive, it's about condom usage, all of them should know how to use them. So as government, what we are doing is creating more awareness, but using partners that we have on board. And we've got some new partners on board today that we will be engaging in the near future. So it's a program that we really want to consider, and we've been also working on, so that we reduce on prevalence and also increase of infectious diseases on the young people. Thank you.
Thank you so
Jean,
much.
if I can add to that, there's no one from Migeprof here, I think, but we recently worked with Migeprof on developing a positive parenting manual to be used mostly at the community level in rural areas. And some of the platforms that will be used to deliver this positive parenting education is existing government platforms like the Umugoro wa Wabyeyi. And this positive parenting covers all age ranges, and recognizing that at different ages, parents need to be able to talk to their children and engage their children in different discussions. So I think maybe that might be something that helps address this issue in the long term.
Thank you so much, Tina. Looks like we have maybe 2 more burning questions, and then we'll move back to focus on the panel.
Thanks a lot. My name is Michaela Rogwizangoga, and I was involved with the project, the Accelerator project, until very recent. Being part of the team that coached the young startups, my question goes to Fiel. Where do you see Umbrella in the next 5 years, in the next 10 years? Today it's an app. I know that there is a community of women who are using your app, but what's the future for your business? Where is it going? Thanks.
Thanks, Michaela. I think it's a difficult question to answer right now, 5 to 10 years, but our vision is to really provide the information directly through the less mediums as possible. So for now, we're working on the app. After, we want to include in more information about different services that are available and that women should take advantage of. So that's I think the next step for us, and also launching the app to the public. So we really want to be the go-to platform or social enterprise for women to learn about their sexual reproductive health, not only through digital, through technology, but also through different programs that can help them evolve. So the goal is to give them the information as fast as possible in the most convenient way for them, by also giving them access to the right information. So a mother won't miss out on a program about that they should know about when they are pregnant, or a girl. So they really making sure they know all the available things they can take advantage of, and also helping in the creation of different opportunities for these women to improve and evolve in life.
Thank you so much, Fiel. So since we went back to the panel, I want us to maybe finish answering unanswered questions. One question went to Malise and coming from DG. Thinking or speaking about confidentiality, but also in general. So we're doing great. We're using technology to tackle health issues, HIV/AIDS in particular. However, that sort of leaves healthcare workers to not being part of the solution. So what do you do to connect your customers in general, not only in terms of confidentiality, but also follow-up care? For example, if we were to take...
Hi, Jeanne. Everything's going well? So sorry to interrupt you. But before you continue, on behalf of Imbuto, we do have a little intervention we'd like to make about our PAC forums, which stand for Parent and Adolescent Communication Forums, and maybe Amanda can highlight that.
Thank you, Casey. As Casey said, we're actually answering the communication between parents and adolescents. So we have these sessions that take place as 2 sessions, where we gather parents and their children to bring out why exactly they don't talk about sexual and reproductive health. And in the first session, they highlight the reasons why they don't talk about this topic. And most of the times, parents highlight reasons as to, most of the times related to their job, they're busy being in the field and so on. And children blame it on the parents, also not having time and making that first step. So after the 2 sessions, you find out that the discussion has actually started in the family, and this is really working where we're doing this. So we're actually working also with the Minister of Gender and Family Promotion, and we developed a guide for parents that, because most of them had expressed that they don't know where to start when they start talking about this subject, and we developed this guide that is available to be printed out by different organizations, and we're about to disseminate it in different sectors and districts. So everyone is free to check it also on our website, where we have the soft copy of that guide. And yeah, we just wanted to highlight that some organizations have started to find solution to that problem. Thank you.
Thank you so much, Amanda. So maybe Malise, and also this will be sort of your closing remark, if you may address the question of your solution, the digital solution, giving more liberty for the customers to be in charge of their own health, but also making sure that we do not leave healthcare providers behind, because that's what they do, that they're there to make sure that we're healthy. How do you link the two?
So in addressing your question, we do offer counseling. When you receive the HIV self-test kit, it comes with instructions, first in 3 different languages to help you to use it. But also there is a toll-free number operated by Project San Francisco, who is our health partner. And a customer can call that number if they have questions about first even using the test, if they don't understand the instructions, but also whatever results they may find, whether they're positive or negative, they have a support mechanism and they usually connect them to other healthcare providers. And we understand we are a private company, and that's why we worked with health partners to deliver that health information aspect. Actually, even for all of our products, the ones that need prescription, we do make sure that the customers provide the prescription. It's great what you can do with technology because you can even send an image via WhatsApp. So there's still other ways to prevent, maybe not that face-to-face interaction, but there's counseling and health information that comes with the pharmaceutical products that we deliver. I know that for each time there's a package that goes, we also have a phone number of the pharmacy that we work with, in case it's not just about the HIV test kits, but we're also distributing other healthcare products. And then I'm also combining it, interestingly, with a comment that was made about Kasha going out of business. Actually, we do welcome that day where it's not confidential. It's not required for me to say, I want to test myself and I have to use Kasha. In that, when that day comes, you use Kasha because it's just convenient, because I don't have to leave my home and I can refill my daily pills without having to walk in, but it's not confidential. So we welcome all of our partners that are doing something to start that conversation and get people to be more comfortable ordering these products, whether online or in person. Thank you.
Yes, sure, Dr. Saba. Yeah.
Do you want to?
On the issue of counseling, we've seen a lot of transformations in the past 3 years. As the face of HIV changed over time with treatments, with people living healthier, and also new infections decreasing some time. The counseling has been updated. So we changed from 3 counseling sessions that were taking people forever at the clinics to come and speak. Even people not following what you say, they know exactly from the first day. So the changes were in a line of simplifying the care and support you're giving to patients. So this self-testing initiative that has been already adopted as in the national policy, and Kasha is just helping as a tool to reach people, but nationwide, the counseling sessions have been simplified in a simplified tool that is in the kit. When you receive a self-test kit, there's a key information for counseling. Then there's a phone you can call, you can ask, and this has been tested in several countries, and evidence shows that actually keeping someone long in unnecessary counseling is more traumatizing than just saying, okay, you have HIV, A, B, C, D, you should live healthier, this is treatment, and it works. Maybe representative of people living HIV may speak better. LLP Plus is represented here. If we have time, they may share their experience. Thank you.
Yeah, I think this works. Just so we're a little behind schedule, so we can make sure we respect our organizer's schedule. I would like to ask our panelists to give closing remarks, but make it 3 words maximum. And I want you to use those 3 words to describe what the future of healthcare, of HIV/AIDS for adolescents will look like in 2 years.
2 years?
Oh, sorry.
So it will be in 2020, just saying.
1, HIV is becoming a chronic disease, a disease of wellness for everyone, including youth. 2, there is a hope of treatment that cure HIV maybe in the next 5 or 10 years But don't ask me if it doesn't happen, but there's a lot of evidence about that. Third, beyond HIV, there are other several challenges that are actually complicating HIV management. Those are comorbidities. And last, with these new technologies, with biomedical services, we can be the first country to end AIDS in the world, starting with young people.
Those were more than 3 words, but that's okay.
I think there's no silver bullets in addressing HIV/AIDS in adolescents, but I think there's an expanded evidence base that shows us what works. I think the Rwanda government and the national HIV response is doing a lot in that framework. We're also operating in a declining donor budget, so we need to address that as well. But I think moving forward, continued strengthening of SRHR, education, and making sure that we're linking those who are affected to treatment and care.
Thank you. Since I think no one did 3 words, so I have 3 bullet points. And I think for me, it's hopefully that it's not stigmatized anymore, whether it's for young people or adults who have HIV/AIDS, that there is an easier access to treatment, and also in people who are interested in testing themselves and know where they stand. And the third point, I think also speak to what you said, hopefully lower than 3%, or what Pacific said. So I hope that we're seeing that decrease.
So I will do very short sentences. Since Lowell did the three words. So I would say first, a learned youth, so who really know about sexual reproductive health, and also ownership about sexual reproductive health and growth. That means the youth succeeding in whatever endeavors they take on. Thank you.
Well, thank you, panelists. Did not respect the 3 words, but that's okay. I would like to thank Imbuto Foundation for organizing this panel, and for trusting the panels and myself for leading you through this conversation. And maybe in closing, what I can say is that even though I started off saying that I wished the global funding money was more going to communicable diseases, but it looks like it might actually be feasible, because we're taking care of the problem with our own solutions. We're already moving into the sustainable phase of things by bringing in tools that are sustainable. If we're all contributing in a little bit, building our own apps, paying for our own solutions, then we're definitely touching the sustainable solution path. But meanwhile, as Dr. Saban said, the youth is still burdened by HIV/AIDS. So we still need everyone involved. We still need the local institutions. We still need the government. We still need partners. We still need youth. We still need ministries, all ministries. We need the health. We need the education, the youth, the family. But I think that if we're all in this together, we'll definitely get to where we want to be in 2020, maybe, or 2030, which is 1990. Thank you all, but before I hand over the mic back to the MC, someone from Gambia has requested to give short remarks as well.
Hello everyone, my name is Nafisa Tambajang from the Gambia. The theme this year is accelerating Africa's single digital market. And one thing I felt that was missing from today is you guys talking about reaching out to other African countries. I know that you mentioned you have your app in Kenya. which is great, but you have other countries in Africa that don't have access to the technology, even though we did trainings grassroots-wise. So do you guys have plans, all of you on the panel, on traveling, if you're going to travel, train, or be hosted by a country and share some of your ideas with the world? Because right now I'm looking at Rwanda like you guys are the real Wakanda. So, so please share with us.
All right, so it sounds like we just got 5 free invitations to Gambia to share our experiences. Thank you so much, everyone. I invite any of you that might have follow-up questions to address them directly to the panelists. Thank you.
Another warm round of applause for our panelists and the moderator. And Jeanne, I do have 3 words for you. No, treat, surprise. It's very easy to do. Now, as we segue into the last part of our program, I'd first like to highlight something that our panelists here talked about. Malise shortly talked about the OraQuick HIV self-test that they have, and Dr. Sabin also did explain a bit of it, but I think it'd be nice for us to have a visual illustration of how we can be able to use them. And like I said, stay tuned, I still have a surprise, so let's still play that video and see what those self-tests are about.
This video shows you how to use the OraQuick HIV self-test properly. The test has been shown to be effective, accurate, and safe to use. It is important to follow the instructions to ensure an accurate result. Please note that if you are HIV positive and taking HIV treatment, this test is not for you, as it may produce a false negative result. Do not eat or drink for 15 minutes before you start the test, or use mouth cleaning products 30 minutes before you start the test. Okay, let's begin. First of all, find a quiet place that has good lighting and a flat surface to perform the test. Open the pack, take out the instructions and read them carefully. The kit contains the test stick, a tube of test liquid, and the tube holder. Find the test tube and remove it by opening the pack. Next, remove the cap, then place the tube in the tube holder. Next, find and remove the test stick. This small packet is for storage only and is not needed for the test. Throw it away. Make sure you don't touch the flat pad. Press the flat pad firmly against your gum and wipe it once along the upper gum and once along the lower one. Put the flat pad all the way into the tube until it touches the bottom. Leave it there for 20 minutes before reading the results. Do not read the result after 40 minutes. Now let's read the result. If there are 2 lines, one next to the C and one next to the T, even if it's very faint, then you may have HIV. If your result shows 2 lines, you should contact your closest healthcare clinic or nurse. They will be able to perform follow-up tests and give you advice on what to do to stay healthy. If there is 1 line next to the C and no line next to the T, then your result is negative. However, if you think you have been exposed to HIV recently, then you should take another test in 3 months. If there is no line next to the C, or a red background makes it impossible to read the result, or if the line is neither next to the C or T, then the test is not working and you need to get another one. Now that you have completed the test, remove the test stick from the tube, put the cap back on, and throw everything away in the normal rubbish. Thank you for using the OraQuick HIV self-test. Now you know your HIV status.
He seemed relieved, yeah? Now, ladies and gentlemen, In closing, I would like to welcome the Permanent Secretary from the Ministry of Health, who, by the way, have been supportive of this initiative and whose partnership Mbuto Foundation truly appreciates. P.S. Welcome.
Honorable Minister, Youth, thanks for being there. DG Mbuto Foundation, DG RBC, there are many of our partners that we want as well to recognize, Country Rep, UNAIDS, UNFPA, UN Women, and there might be others as well in the room. Other DGs, former DG Mbuto, they told me DG Mukuru. Youth, I can say from the second law. The first law, I saw he was busy with other people, but really you from the second law, good evening. Actually, that will be the only part of my speech that I will read, because I learn a lot. Let me echo the predecessors on what they have said. I learned a lot from what I saw tonight or this evening, that I want basically to recap what I consider as my takeaway message from the session we have just concluded. I learned the first things that youth are doing a lot. First, they know more. They are doing a lot that actually sometimes in the ministry we don't know. And I want really to convey that we truly thank the youth who have taught us this afternoon and this evening. And through the presentations and the excellent videos that were played, no one could doubt that youth have a multifaceted relationship with technology. I think that's a fact. Technology provides powerful means through which spread information, educate and support youth. That's as well another fact, that we've seen the technology that we can pass the message, educate and support youth. The same tools may also link youth to services, which is something that I think was important to raise on what Kasha presented. I think Deja Janine alluded to it, that not only youth needs to have quick and time-limited services, but as well we need to ensure the continuum of care. The youth who takes on oral quick tests, if I give that as an example, how easy they are linked to the services if their tests reveal their HIV positives. I think we need as well technology that will help to link them to the services. However, there has something as well that I think we didn't touch during our discussions. Technology may also facilitate youth exposure to behavioral issues. I think we can cite some, like non-disclosure of HIV status to partners met online. Is that true? Is that feasible? Right? Number two, social. We can see stigma, prejudice, barring among youth. Again, we have all to remember that content shared among youth on social networking sites and the perceptions of peers' behavior may also affect offline sexual risk and tension and behaviors. So those are as well things that we have all to be aware of. Not only technology provides solutions, but as well technology can be as well work negative on the other side. So we need as well to come up with a better understanding and correctly teach our youth on how technology should be used for their welfare and trigger their behavior to be positive behaviors. Now, The other thing that I reflected on when I was sitting there really following up the discussions, and that was one of the key questions that DG Mbuto sent to me, how policymakers and development partners should address specific needs of young people. I really want to confess that I don't think we are doing it in the right way, the policymakers. I reflected on a few policies that we recently put in place and strategic plans like the adolescent sexual reproductive health. I looked at the list of people who were consulted. You know, the youngest was 48 or so. And you wonder if that policy really is going to come up with the content that really reflects what youth needs. I think, you know, fortunately, there are still drafts. And we're going to work together with all the partners and make sure that we get youth to provide their inputs to make sure that the policies and the strategies we're putting at their disposal are really helpful and tailored to their needs. So at the ministry, we consider youth as a center for policy making and not beneficiaries. And we're going to improve on that. We look at youth as channel for implementation, not as a targeted group, which has been something that we were kind of doing, really, youth being target, not being implementers or actually policy makers. So that's something that as well we need to change at the ministry level and at partners level. Youth as ones to tell us how the policies are working, not as assuming that just youth are not complying. Policies are great, but youth are not with us. So I think those are things that, while I was reflecting on this afternoon discussions, that I think at the partners and the ministry level we should as well change. So having youth really being part of us. So I will not take much of your time. Casey has already alluded to other many things that are going to follow. I just want to convey that the Ministry of Health is committed to work with you all, especially the youth. We thank Mbuto Foundation, which is spearheading much efforts towards involvement of the youth into policy making, but as well youth as the key implementers. We have commended different efforts and different initiatives that the youth has presented this afternoon. Such things like To Be Ghana, a TV show, apps like Tantin, Umbrella, the Kasha solutions, and the others that could not be presented this afternoon. The ministry is pretty committed that together we can roll them out. We can as well input them and actually facilitate and support their implementation. We have recently started to have youth leaders, but as well youth groups and youth entrepreneurs to become our partners in the Ministry of Health. And we've recently concluded about 3 MOUs with youth groups, and we have set different ways that we are going to work together to support the youth taking more on health initiatives to deliver on their peers. We again want to thank all the community that is working towards availing devices for monitoring and as well supporting the ARV uptake among youth, which Dr. Sabe alluded to, because the adherence of youth to antiretroviral treatment is still something to improve. So we really welcome entrepreneurs in terms of digital health who can come up with a solution which can help the young ones to be more adherent to treatment. Again, we are committed to work with you, then together work for you. Thank you so much.
Another round of applause for the Permanent Secretary from the Ministry of Health. Thank you for everyone. Thank you to everyone for making the time to attend our session. We know it's been a busy day, and we hope that this session was a great way to end it. I encourage everyone to continue to have these conversations because, like I said, the Youth Forum series is one of our cool events. And if you are eager to continue to have these conversations outside of this room, we more than encourage it. The great content doesn't end here, though. We have good news. Mbutu Foundation has a booth and will be at Transform Africa until May 10th. So if you'd like to visit us, we are more than happy to have you. We will continue to elaborate on the many programs that we have, and like I continue to say, our cool programs. And here comes the surprise. If I can have a drum roll. In the efforts to continue to sustain our theme today, which is No Treat Suppress, if anyone in this room would like to know their status, we have some oral quick tests that are outside for anyone to be able to pick up on the way out. I end today thanking every single person for taking their time because it's a privilege to everyone in here and to me as well to learn from everyone. And I'd like to close off this session by quoting some of the words that DG Sandrine started with or ended her remarks with here. Let us not only look at this fight through a new lens, but let us become the new lens through which our current issues are transformed into solutions. Have a good evening, and thank you very much.